Jai Shri Gurudev. Today's class also be the continuation of endocrine disorders. In today's class, we will be studying the causes and the symptoms of endocrine disorders like diabetes mellitus, Cushing's syndrome, and Addison's disease. Diabetes mellitus refers to a group of diseases that affect how our body uses blood sugar, that is glucose. Glucose is vital to our health because it's an important source of energy for the cells that make up our muscles and tissues. It's also our brain's main source of fuel. The underlying cause of diabetes varies by its type, but no matter what type of diabetes, it can lead to excess sugar in our blood. Too much sugar in our blood can lead to serious health problems. Diabetes mellitus is a chronic disease primarily due to a disorder of carbohydrate metabolism, which is the cause of which is deficiency or diminished effectiveness of insulin. Either there will be deficiency in the hormone insulin secretion, or there will be diminished effectiveness of the hormone insulin. These two reasons could be the reason for the diabetes mellitus, ultimately which result in hyperglycemia and glycosuria. Hyperglycemia is a condition in which the blood glucose level is increased than the normal, and glycosuria is the condition where which the excess of the glucose uh, get eliminated along with the urine. These two are the uh, conditions: hyperglycemia or glycosuria, wherein which the glucose level is high. Another condition is hypoglycemia, wherein the glucose level in the blood is less than the normal one. Diabetes mellitus could be categorized into two categories. One is chronic diabetes mellitus, another one is reversible diabetes mellitus. Chronic diabetes mellitus include type 1 diabetes and type 2 diabetes. Type 1 diabetes could also be referred as insulin dependent diabetes mellitus, IDDM, which happens or which appears early in the life, in which there will be, it is a autoimmune disorder, we can call it as autoimmune disorder, in which autoimmune disorder means our own immune system actually normally fights harmful bacteria or viruses, attacks and destroys them. But here the own immune system identify own cell as a foreign cell, and which will destroy the cells. The same thing happen here in the insulin dependent diabetes mellitus, wherein an autoimmune destruction of the pancreatic B cells of the pancreas, which is responsible for the production and synthesis of the insulin hormone. Here the pancreatic cell beta cells get destroyed by the autoimmune system, therefore there will be no production of the insulin hormone from the pancreas. Therefore, the blood glucose will not get converted into polysaccharides and get stored up in the cells. Rather, they remain in the bloodstream itself. Therefore, this increases blood glucose concentration. This condition is known as type 1 diabetes mellitus. Type 2 diabetes mellitus is otherwise referred as non-insulin dependent diabetes mellitus, which could be observed in the older age or in the obese person. Here, insulin is produced, but some features of the insulin response system is defective. That means the beta cells of the pancreas, islets of Langerhans, which is present in the pancreas, particularly the beta cells are normal and they produce enough amount of insulin, but at the receiving end, the receptor cells or the target cells do not respond in a proper way. There will be a defect, and then also there will be no intaking of excess glucose into the cell. In that case, the glucose remain in the bloodstream itself, and which increase the blood glucose concentration. This is type 2 diabetes mellitus. The second category of diabetes mellitus is the reversible diabetes mellitus, which includes pre-diabetes and gestational diabetes. Pre-diabetes means when the blood sugar level are higher than the normal, but not high enough to be classified as diabetes, which means that in this condition the person may have high blood glucose level, but which is not at the longer time or longer term. Therefore, the person cannot be called as diabetes, which may occur during the stress, that is stressful conditions like work pressure or any emotional suppression, during which the blood glucose level may increase, but that is not enough to be call that particular person as diabetic. So this is pre-diabetes, but care must be taken, otherwise which may lead to a chronic condition of type 1 or type 2 type of diabetes mellitus. Another one is gestational diabetes, which is also a condition in which during pregnancy the diabetic condition will be seen, that is increased blood glucose level will be seen only during the pregnancy time, that is gestational period, but which may be resolved as its own after the baby is delivered, which is for a short period or occasional, that is during the pregnancy it is happening, therefore which is called gestational diabetes mellitus. To understand the diabetes, first we must understand how glucose is normally processed in the body, that is how insulin works. The beta cells of the islets of Langerhans of pancreas secretes insulin hormone, that the insulin hormone enters a bloodstream from the pancreas. Meantime, glucose enters bloodstream from the digestive system and even from the liver. When there is insulin in the blood, This insulin binds to the cell and make the cell to respond in such a way that to take up glucose, and which is used as a fuel, that is for the energy purpose, thereby which lowers the blood glucose concentration in the blood, which implies the healthy balance of glucose. This is the overall idea of the action of insulin. As we know, the cause of diabetes mellitus type 1, that is insulin dependent diabetes mellitus, the exact cause of type 1 diabetes is unknown. What is known is that our immune system, which actually fights harmful bacteria and viruses, attacks and destroys them. Here in this condition, the antibodies produced destroy the insulin producing cells in the pancreas, that is the beta cells of the pancreas. Therefore, there will be little or no insulin production take place. This is a condition in which glucose enters bloodstream from the digestive system and the liver. They absorb glucose from the digestive system or the reserve food which is present in the liver get converted into glucose which enter into the blood, but there will be no insulin available for the binding with the cell. Therefore, the glucose cannot be taken in by the cells, and thus the cell has no glucose for fuel. In this condition, the glucose keep on accumulate or return to the bloodstream, which leads to unhealthy amount of glucose circulation in the bloodstream. Now the blood glucose concentration is higher than the normal. This is the action plan or the cause of the diabetes mellitus 1. Simply we can say that the autoimmune system attacks own cells of the islets of Langerhans of pancreas that will destroy the beta cells. Therefore, there will be little or almost no insulin secretion from the pancreas. Therefore, the glucose remain as such in the bloodstream. In this condition, that is diabetes mellitus type 2 condition, which is also referred as non-insulin dependent diabetes mellitus, there will be normal secretion of insulin take place from the pancreas and insulin enters into the bloodstream. Meanwhile, the glucose enters bloodstream from the digestive system and the liver, but the insulin is unable to bind with the targeting cell because there will be defect in the receptors present over the membrane of the target cell. Hence, the glucose cannot enter into the cell, and therefore the cell has no glucose for its energy, and the glucose keep on accumulating in the bloodstream, and which leads to unhealthy condition, that is increased blood glucose concentration in the blood. This is the main cause for the diabetes mellitus type 2. Let us know the symptoms of diabetes mellitus 1 and 2. In this person may lose the body weight. That is the prime symptom of diabetes. And person will experience extreme tiredness and also experiences increased hunger for food and thirst for drink or water, and tend to urinate frequently. Tingling or numbness in the palm or the sensitive area in the hand, and the vision will be blurred, and the wounds will or the sore will take longer time to get healed. That is slow healing process. And when the person urinates, that urine contains more amount of glucose, therefore which will attract the ants. These are the some of the symptoms of diabetes mellitus. Cushing's syndrome, and this could be the body posture or the condition in Cushing's syndrome. It is occurring when our body is exposed to high levels of hormone, that is cortisol, for a long time. And Cushing syndrome, sometimes called hypercortisolism, may be caused by the use of oral corticosteroid medication. This condition can also occur when our body makes too much cortisol on its own. So, cortisol, which is referring with the hormone of the adrenal gland, when cortisol hormone, corticosteroids, are in excess, which may lead to a condition known as Cushing's syndrome. The causes of Cushing syndrome include: the most common cause of Cushing syndrome is the use of corticosteroid medications like prednisone, which is actually used or prescribed to treat inflammatory diseases or to prevent rejection of the transplanted organ, when which is in high dose for a longer period, which will lead to Cushing's syndrome. High doses of injectable steroids for treatment of back pain can also cause Cushing's syndrome. However, lower dose steroid in the form of inhalants, such as those used for asthma, or creams, such as those prescribed for eczema, usually aren't enough to cause the condition. And other things are the tumors. Several kinds of tumors can also lead to a higher production of cortisol from the adrenal gland. Some of these are included here. It is pituitary gland tumor. When there is a tumor in the pituitary gland releases too much of adrenocorticotropic hormone. Actually, this adrenocorticotropic hormone ACTH trigger the secretion of cortisol hormone from the adrenal gland. Therefore, increased ACTH due to the tumor formation in the pituitary gland will increase simultaneously the cortisol concentration, hormone concentration. This could be the condition for the Cushing syndrome. Or ectopic tumors, like the tumors which are developing outside the pituitary, may also responsible for the increased production of the ACTH hormone. Increased ACTH increases the uh, higher amount of cortisol from the adrenal gland. or the tumor in the adrenal gland or the abnormality in the adrenal gland can also lead to irregular patterns of cortisol production, which can cause Cushing's syndrome. And the familial Cushing's syndrome, although Cushing's syndrome isn't typically inherited, it is possible to have an inherited tendency to develop tumors of the endocrine glands. The symptoms of Cushing's syndrome include weight gain and fatty tissue deposits, particularly around the midsection and upper back. In the face, there will be deposition of the fat tissue, and which gives a moon face appearance. And between the shoulders, there will be a deposition, and which is the condition called buffalo hump. And another symptom is pink or purple stretch marks on the skin of the abdomen, thighs, breasts, and arms. And there will be thinning and fragile skin. A person may undergo slow healing of cuts or insect bites and infections. Even the small insect bite cannot be cured rapidly, or small cuts can be healed very slow, and there will be acne formation. Some of the signs and symptoms women with Cushing syndrome may experience are thicker or more visible body and facial hair. In women, there will be body very broad and facial area will be higher. Irregular or absence of menstrual periods. In case of men, the symptoms could be decreased libido, decreased fertility, and there will be erectile dysfunction. Other signs and symptoms that may occur with Cushing syndromes are severe fatigue, muscular weakness, depression, anxiety, and irritability, loss of emotional control, new or worsened high blood pressure, headache, increased pigmentation of the skin, bone loss leading to fractures over time. In children, there will be impaired growth. These are the symptoms of Cushing syndrome. The Addison's disease, which is also related with the adrenal gland. Adrenal glands are located on the top of kidneys. These glands produce many of the hormones that our body needs for normal functions. Addison's disease occurs when the adrenal cortex is damaged and the adrenal gland do not produce enough of the steroid hormones like cortisol and aldosterone. The cortisol regulates the body's reactions to stressful situation, whereas the aldosterone helps with sodium and potassium regulation. The adrenal cortex also produce other sex hormones. Causes of Addison's disease could be categorized into two major type, that is primary adrenal insufficiency and secondary adrenal insufficiency. In primary adrenal insufficiency occurs when the adrenal glands are damaged or so severely damaged that they can no longer produce hormones. This type of Addison's disease is most often caused when the immune system attacks our adrenal glands. This is called an autoimmune disease. This is the major cause for the Addison's disease. In an autoimmune disease, our body's immune system mistakes any organ or area of the body for a virus or bacteria or another outside invader, and which destroy the cells of the adrenal gland. Thereby, there will be decreased or no secretion of the adrenal hormones. Other causes of primary adrenal insufficiency include prolonged administration of glucocorticoids, like as we discussed in the previous one, that is prednisone, which is used for treatment of the inflammatory diseases or which is used during the organ transplantation to avoid the rejection, or which could be infections in our body, or cancerous or abnormal growths in the adrenal gland may also lead to the destruction of the adrenal cells, or certain blood thinners used to control clotting in the blood. The secondary adrenal insufficiency occurs when the pituitary gland cannot produce adrenocorticotropic hormone. Here, the pituitary is affected, and which in turn um, give slow or low secretion of adrenocorticotropic hormone. Actually, this adrenocorticotropic hormone ACTH tells the adrenal gland when to release hormone. So, if the ACTH is not in good proportion, then the adrenal gland will not respond or will not release its hormone. It is also possible to develop adrenal insufficiency if you don't take the corticosteroid medications your doctor prescribed. In the medical condition, the doctor may prescribe to administrate corticosteroid hormones as a medicine. If the person do not take in a required quantity or in a required period, then which may also lead to the condition of Addison's disease. Tumors could be another cause of the medication, and the traumatic brain injury may lead to decrease the secretion of ACTH. Thereby, there will be decreasing secretion of the adrenal hormones, which may lead to Addison's disease. The symptoms of Addison's disease: people who have Addison's disease may experience the following symptoms: muscle weakness, fatigue and tiredness, darkening in skin color, weight loss or decreased appetite, a decrease in the heart rate or blood pressure, low blood sugar level, fainting spells, sore in the mouth, craving for salt, nausea, vomiting. People living with Addison's disease may also experience neuropsychotic symptoms such as irritability or depression, lack of energy, sleep disturbance. These are the symptoms of Addison's disease. Thank you.